All right, good evening, good afternoon, depending on where you are. Um, Welcome to our webinar. We entitled it Coaching the Struggling Student. I'm pleased to introduce our panel to you. If I can get the slides to advance. There we go. Oh boy. I'm gonna reshare. All right, off to a good start. Thank you for your patience. How about while I reload that PowerPoint, our panelists, will you please introduce yourself? Sarah, if you want to go first, that'd be great.
Sure, I'm happy to start. Hi, everybody. Welcome. Good to see so many of you this evening. I'm Sarah Tariq. In a former life was Associate Dean of Student Affairs at University of Arkansas for Medical Sciences. Currently, I'm a primary care physician at Northern Virginia Family Practice and executive leadership coach. Graduated from the UT Dallas School of Management. Nice to see you all.
And so I'll go next. I'm Chris McGinnis. I'm the co-director of learning communities at UMass Chan Medical School in Worcester, Massachusetts. And our medical school is starting a coaching program. This is our second year. I see one of my most favorite faculty on the call as sort of a coaching expert extraordinaire. I'm so pleased to be with you and to participate in the webinar.
Hi, and I'm Brooke Hubner. I am at the UAB Hearsing School of Medicine. I direct our academic success program, and I'm an educational psychologist working with students around step 1 and step 2 exams. So I have a lot of opportunities to work with struggling learners, and really excited to see everyone and glad to be here.
All right, how this session is going to basically go is I'm going to give a little bit of background on coaching to give you guys an idea. I'm sure a lot of you have a basic understanding of coaching, and then we're going to discuss some cases. And so if we'll just jump right in. So really, when you think about coaching, um, the basic philosophy of coaching is that it assumes that the client, learner, student first and foremost is whole, right? We, as coaches, we recognize that and utilize the individual's agency, their autonomy, and their self-efficacy. And so coaching is this developmental longitudinal relationship focused on achieving whatever goals the client has or the learner has set forth for themselves, right? And so the coach's job is really to help the learner identify what those goals are and develop solutions through non-directive questions that ultimately open awareness. The coach's job is also to really try to understand the world, if you will, from the client's worldview, from the client's perspective. And so there's a real focus on self-reflection, on autonomy, and professional growth. And so the essence of coaching really is three different areas. One is creating awareness that I'm going to spend a decent amount of time on. Two is creating clarity and then moving forward. And so these are three focuses, if you will, of the coach, foci of the coach, all the whole while deeply honoring the relationship that we have. And so I'd like to spend a minute or two digging a bit deeper into what each of these components are. So, in terms of awareness, really awareness identifies for their learner. So I'm just going to use the term learner since that's what we're talking about in this context. Identifies for their learner their underlying concerns, including the typical ways of perceiving the world that they have, and sometimes the fixed ways of perceiving the world and perceiving themselves. And while the coach spends a lot of time on awareness, helping the learner see the difference between the actual facts and their interpretation of what happened or the facts, and then the disparities that they may have between their thinking or what's sort of going on in their internal world and the outer world. ultimately leading to action. And so it helps the learner discover for themselves new thoughts, new ideas, different belief systems, and ultimately getting to those actions. And so the hope is that we strengthen our learners' ability to take action and achieve whatever is important to them. And so, in order for that to happen, the coach has to listen beyond the words and not get sucked into the details of the narrative, right? So that in order to, where our goal is really to stretch the client's frame of thinking or the learner's frame of thinking and really sort of expand their mind. We then move on to clarity, which is we really try to uncover what really matters to our learners. And sometimes that takes a little bit of digging as well, because you really want to align their intention that they have about their exams, their steps, their success, their residency, their matching, and align their intentions with their actions. And so in order to do that, in order to create clarity, we really have to, dig and uncover the learning and kind of look underneath the iceberg for them, or help them look underneath the iceberg with the ultimate goal of getting them to a plan of what they're going to do. Right. And so we want to create a supportive structure to stay true and courageous to their decision and really help them be committed. And so the next couple of slides, I'm actually going to share with you some questions that you can hopefully take away and maybe practice using some of them and seeing how they end up for your learners, right? So there's 5 steps to evoke awareness in team coaching sessions. 1, all of our questions are open-ended, right? Number 2, we create space for silence to allow our learners to reflect on our question and reflect on their own ideas before they respond. So you kind of have to get comfortable with pauses. The next kind of thing that we ask about or focus on is what can we learn from this experience? So that's another common question that a coach might use. You had this good experience or you had this challenging experience. What did you really learn from it? In coaching, we're encouraged to use metaphors to help clients visualize their challenge. So there's a lot of neuroscience that sort of is built behind a lot of these questions and what we're trying to evoke here. So an example is, what if this issue, imagine this issue that you had with an exam or with your grades. What if it was actually a roadblock, like an actual block of construction in the road? How would you move past it? And so sometimes really having our learners focus on and visualize can be very helpful. And then the next thing that we do is we reframe challenges, right? How could this limitation become an opportunity for you? Yeah, you had this difficulty. Let's flip it on its back and let's ask another question, which is what good can come out of this? Next slide. And so ultimately, what we're trying to do is we use powerful questions that will hopefully open awareness, that literally opens doors in our learners' brains to bypass those critical filters, those fixed ideas, to bring to the surface their self-limited beliefs, which ultimately, hopefully, will be a catalyst for change and result in some successful outcomes and successful conversations. And in the next slide, I've got some actual questions that help expand awareness, right? What beliefs do you have about yourself that might be holding you back? And what is the cost of holding such beliefs? So these are tough questions that are not easily answerable, that really do take a little bit of self-reflection. What's important to you about this outcome, right? This is a really important question because so many learners and medical students don't feel like a lot is in their control, thanks to the system that they operate in. But what is in your control? Really getting to self-efficacy, right? And self-empowerment. What strengths can you utilize? What strengths do you bring to the table that you can utilize to make this change in your life? And what changes are needed to move forward? So those are some questions that expand awareness. And the next slide, there are questions that help create clarity. This is one of my favorite. What values are most important to you in life? And how do they influence your decisions, right? How will you know that you will have achieved the outcome? In some ways, that can be really obvious. Well, I know I will have achieved it if I make a certain score on whatever. But sometimes it's a little bit more abstract and a little bit more challenging. what is the problem in a nutshell for you? This is really helpful for students who are all over the place and who are really having difficulty articulating what the main issue is. And then on a scale of 1 to 10, how confident are you that you can achieve this goal, right? So we use a lot of motivational interviewing techniques. And then, there's a growing data on how coaching can help and why it matters in medical education. We've got studies and some literature that's, again, talks about that it supports academic and career development. It builds resilience and well-being. It enhances communication and leadership skills. And it really helps our learners navigate complex, ever-changing clinical environments where there's a lot of uncertainty. There was actually, in terms of resilience and well-being, I know we talk a lot about it, but there was a study published by one of our own LCI former leaders, Dr. Sunny Smith, last year it was actually done in the middle of the pandemic. It was published last year that looked at 200 women physicians who had extremely high burnout rates, like 77% burnout at baseline, and very low self-valuation scores, like 17% at baseline. They took these women physicians and just conducted 8 one-on-one coaching sessions with them. And then there was some opportunity to do some group sessions as well. And after 8 sessions, burnout, which was 77% at baseline, went down to 33%. Self-valuation, which was 17% at baseline, went up to 64%. So there's some really interesting data and studies that are coming out and probably continue to come out as the number of physicians who are entering executive coaching and leadership coaching continues to increase. Next slide. And so just to really, before I go talk in terms of modeling, there are different ways medical schools and systems can have coaching programs. We can have longitudinal coaching programs where there are faculty specifically assigned to students or anybody really in the medical school and can have a longitudinal coaching program. Usually that's about 6 to 8 sessions. We can have peer coaching programs. There's faculty to student coaching relationships, and there's some sort of hybrid where we can integrate some coaching model with the academic advising programming. And again, to summarize, core principles: active listening, powerful questioning, helping the students set their own goals, and accountability. Some of the challenging parts of being a coach is really being non-judgmental as you possibly can and supportive. And that can be frustrating and difficult sometimes when you've been dealing with the same learner and you were continued to be challenged. But we're really focusing on learner-driven solutions, right? It's not us creating the plan for the learner. It's really the learner creating their plan for themselves. Just very briefly, a lot of people kind of sort of question, like, what's the difference between coaching versus advising versus mentoring? Because in learning communities, we tend to do a little bit of both. But coaching is, again, very forward focused. It's goal focused and learner driven. It is longitudinal. It takes time to do this. Whereas advising tends to be very task oriented. Advising tends to be one way. It's us being directive and giving information, providing information for our learners. It tends to be a little bit more detailed. And then mentoring, of course, is very long-term. It's very relationship-based, and the support is based on, my personal experience that I'm imparting to you. The coach does not assume to know anything. And the coach does not provide any advice or directive. The coach's job, 80% of the time, is to ask those questions that create awareness. And I'll just end with this last slide. And again, as I've reflected on studies and I tried to do a quick search, another study came out about 2 years ago. This was self-reported by medical students. And again, medical students who received longitudinal coaching noted that they had improved self-awareness. And that's a big win, right, for a lot of our students. So lots of confidence, greater clarity in their career path. Sometimes our students go into the 3rd year and they kind of get confused and they're not clear about where they want to go. So coaching can really create awareness and open those doors in the brain. That does create clarity for our students. Better stress management, which of course is extremely important, and then enhanced academic performance. And I think we're going to see more data on all 4 of these domains. And now I'm going to hand it over to our other panelists to discuss our cases.
Okay, thank you so much, Sarah. So as you kind of read through this case, and I'll summarize, I think Alex may be familiar to some of you. She's a 23-year-old first-year medical student, about 4 months into the preclinical curriculum. She has a lot of expectations from family physicians, and so she feels that pressure, and she's struggling. She's failed a recent exam, missed a couple of her small group sessions, starting to submit assignments late. Faculty report that she's starting to not participate in team-based learning. She seems tired, disengaged, and really lacking that interactive experience. Her learning specialist checked in, and Alex is pushing back on the reflections and the group discussions, and very focused on medicine. She doesn't like going to class because she's behind, hates being called on, not sure she's correct. So we've seen that learner, right, who's scared to be wrong, doesn't want to seem vulnerable, and when they're behind, they're even more likely to disengage. She's sleeping 4 to 5 hours a night, relying on all-nighters, cramming, would like to study independently in her apartment rather than engaging with peers. And now we're starting to see that that academic outcome of these study habits. So Alex may resonate with some of you. And so now let's think about how might we engage in a coaching discussion with her? Again, thinking about the coaching aspect rather than that advising when we see some really specific things that we'd like to be very probably task-oriented and directive. So next slide. You're thinking about her growth, first-year student, first semester. What are the professional development concerns that we want to think about as supporting her growth through medical school? Building out resilience and adaptability, certainly professional responsibility, collaboration, communication, and then of course, self-care. And that self-care and sustaining those healthy habits through medical school. So again, it's easy to get in that framework of, let's think about what actions we can take to direct Alex to be sort of more engaged, but pulling back to that coaching mindset, how do we promote that professional growth and engage with Alex to help her think about the awareness that she needs to gain to affect change? And so the next slide, we'll look at some coaching points. So how do we first start sort of, I think what Sarah said so well is honoring that relationship and centering the student. So building that connection, we can start having those conversations. Linking that academic behavior to professional identity. Talking with Alex about what matters, opening up that intention to have action and take action. Certainly with that pressure from her family, we're thinking about what are her goals relative to the expectations, and how are her behaviors impacting that. So keeping that intention to help aligning that attention with the action. Promoting sustainable performance habits. So thinking about what are the things that we can see that is not healthy and not sustainable, but getting Alex to engage. So just kind of touching back on some of that case evidence. We think about missing the sessions, late with reflections, avoiding eye contact, minimal participation. Linking that to what matters for her, and linking it to that professional identity, professional role. And then finally, as the coach, it's always important to stay alert to patterns of withdrawal. So, we learned that this coaching is a longitudinal relationship, which is nice because you can start to see growth or start to see maybe a pattern that isn't so healthy. So being alert to referral needs, seeing if that isolation and exhaustion continues and persists. So those are sort of the high level coaching points that we want to connect back to the failed exam, some of those very specific behaviors, missing sessions, not having good sleep hygiene. And then our next slide, we're actually going to translate these high level points into actual strategies that you might use as a coach. Sarah talked about the what questions, and I find that so helpful to think about what are the behaviors? What are your study patterns? What are the energy barriers? And then trying to bring clarity to Alex so that she can then start to think about the goals that she has, reflecting on the observed patterns of missed sessions with her, making her a partner in that conversation, again, by linking the behaviors to her professional identity. Is isolation really what you see as a physician? So what does a physician look like? That might be a question you might use. What does your perspective of a physician look like? And to open up that mind and get that thought pattern changing. And so brainstorming some habits with her, again, centering the learner in this space. So it's learner driven versus task oriented. We may instinctively want to tell her what we want to do as a first year to get moving. But the goal of the coach is that brainstorming process, asking her, what do you want to do? Can you think of something that you want to change as you've had the discussion? Where are you now? Where do you want to go? And then having the learner, having Alex in this case, identify some realistic habit changes that are measurable that you can circle back to in later conversations. So that might be encouraging gradual reconnection with peers. But that may be something that Alex comes up with differently, with a question like, well, what could you do? What are your options? If one of your goals is to reconnect with peers, what would that look like? And letting the learner then come up with the solution. And maybe the first step is engaging on Zoom with them, because that doesn't feel as scary as venturing out, but building out some simple goals to create the more healthy, sustainable habits. And then always being ready with that referral if exhaustion and disengagement, rise to the surface of needing a referral. Next slide, we're going to talk about one of the models I like to use because it's simple. And when you're in the middle of a coaching session and sometimes you're, trying to stay so listening beyond sort of that experience that they're talking about and listening for, I think what Sarah said is listening beyond words, and that is so beautifully put, it's helpful for me just to think about grow. What is our goal? What is a clear goal? And what do you want to do, learner? Alex, what do you want to do here? The reality, where are you now? Where are you in this space? And then what can we do? So we have this roadblock, using the metaphor example. We have this roadblock of starting to write a reflection, coming to a group session, and being okay with not being fully prepared. So what does that look like for you? How do you get around that roadblock? And then creating an accountability structure that's around that will or way forward. So the W in the GROW model. And that one's easy for me to think about because it's what will you do? Like, what are your plans? And that sort of is a model that I like as a quick and easy thing for me to go back to when you're in a conversation with a learner that can be really intense. There's a lot of different models out there, and we'll hear about them. But that's sort of Alex in a nutshell, and some ideas of how you might, as a coach, approach that connection, that academic behavior to professional identity, promoting some sustainable habits through some building awareness and using those questions around what do you want to do, where do you want to go. I'll pause here and see if folks have questions. Ask if there's anything that sort of you saw in Alex's case that you want to highlight and think about how would you coach a student toward addressing the need that you may have seen. We can put things in the chat or someone, if there's any questions, conversation.
Yeah, hi, my name is Lisa. I'm Chris's colleague, and thanks for doing this session. And I was going to just say, and I'm sorry I won't be able to stay for the whole meeting, but as a first year student, I may not know her very well, and I want to just throw out this idea that you would kind of go way back out, like Google Earth view of this situation, and ask the student to kind of help me understand what is happening in their own words, like, because I'm still kind of at the hypothesis forming stage, idea, like phase of what's going on. I mean, I certainly reading the case could throw out a lot of ideas, but I feel like as a coach, my responsibility is to sort of stay in the not knowing and to let the student tell me in their own words what is happening. And so I love the phrase, I use it all the time, help me understand, or I'm wondering, those as basic kind of openers. And then I do just want to very respectfully push back on the idea that a first year student has any real professional identity, because I think they're just really don't. And I think that phrase would kind of, in my own experience, probably fall flat. They're here to develop a professional identity, but I think it's like talking to a patient with jargon when we say, I think you have nephrolithiasis, and when we really need to say, I think you might have a kidney stone, and, asking them, what's your experience with how doctors act in situations? And then we might name the professional identity as a thing, but I think I would kind of anticipate if I said that to her, she'd maybe glaze over. And so that's all. But excellent case. And
yeah. Thank you so much, Lisa. I agree with you. I think, and I may have not phrased that well with that professional identity, thinking of it as what are her values, her professional values, and what does she see, like you said, what does she see that future, not where she is right now. And I love the metaphor of that Google Earth view, because you're right. In this case, we have a lot of data, right? We have faculty saying, look at all the failures, look at all the tardies, the learning specialists chiming in with what they're seeing. But you're right. What is that? Let's pull all the way back out and think about what is being open to whatever may be going on, because it may not be what we think. So I like that Google Earth view. I'm going to write that down for later. So it looks like there's a hand up. Dr. Johnston.
Yeah, thank you. I really did appreciate both of the ladies' commentary, really all three of them. But when I've encountered scenarios similar to this, the first thing that comes to my mind is I just want to make sure the student knows that there's a support system out here. We are here to help, not here to pry, but we have noticed this, and this over the few months of the curriculum, that this is where you're at in your performance. And I'd really want to make sure that this student doesn't slip into a downward spiral of depression or giving up or throwing in the towel, because it's just, they've only been here for a few months. And something's going on. And I'd want to know what their rhythm is, so their academic rhythm is. What kind of study program do you have? Are you in a safe environment? Do you feel comfortable with what you're doing? Making sure they don't slip into some imposter syndrome or something like that that says, do I really deserve to be here? Not the point. We know that you've got the aptitude to make it, because you wouldn't have gotten in to a medical school or a professional school had you not had the prerequisites met. And now we're seeing a decrease in your performance. We're here to help. Please share. I'm not trying to pry, but please share with us if there's anything we can do to help support you in this process. That's my 2 cents.
No, thank you. I think that's so important, that creating that space and that connection is so critical. And I think really the gist of what you're talking about is that problem solving. So approaching this open to get clarity around what the problem might be, and being open to all the options that might be on the table that are contributing to this learner who is struggling at the moment for whatever reason it might be. All right, another hand up. Like Alan?
Yes. I just wanted to chime in because we've all had students like this, but a particular one struck me. Something I try to tactfully do is ask questions about their living situation. And in the case of a student that I am thinking of, the vast majority of her problems was because of food insecurity and not being able to put gas in the car. And that's something we don't usually think about medical students practically being homeless. But in this situation, this individual had a place to live, but they could not feed themselves. They could not get to campus. So I went to talk to Dr. Tarek, and we got this person some help. So that's something to keep in mind, that it might not actually have something to do with school.
And I 100% agree. So many of academic challenges are because of something else. And that's why it is so important to sort of meet the learner where they are and be open to whatever they may bring. It's the beauty of that longitudinal coaching relationship. So you can build that security and connection and then start to problem solve. Yeah, it's manifesting. And frankly, students don't know anything more than to blame, sleep, academics. I don't want to be in the group, because they're not going to lead with, because I don't, I'm dealing with food insecurity, because medical students probably believe they could go for a week without food and still pass exams. And they just need to buckle down and work harder. So I agree. Jason, you've got your hand up.
Yeah, thanks, y'all, for this. This is really helpful stuff. So I'm Jason. I'm in Student Affairs Office at UAB with Brooke and, sorry, Dr. Hubner. And and I was thinking about, in this situation, what the student, and Brooke, you kind of alluded to it. The problem the student thought they were, the problem the student brought is not the problem necessarily, or it's one of the problems. It's a symptom. And I guess when I think about coaching, I think about it more as I'm seeking out coaching for a particular problem or issue. And I'm wondering, and y'all maybe are going to get to this, but I'm wondering if y'all have ideas or thoughts about what to do when a student comes in abstentious, or thinking that it's an advising appointment or a check-in, and you realize what they really need is some coaching, and you're sort of trying to do a Jedi mind trick on them to get into a coaching session when that's not really what they signed up for. And how do you kind of think through that a little bit with students who really would love a 15-minute answer to their problem, but might need a little bit more than that. And anyway, just kind of thinking about the difference. Like, sorry, you talked a little bit about the difference between mentoring and coaching and advising and coaching, but I'm just trying to think about like when a student comes in thinking they're getting one thing or coming for one thing, and then we kind of see it as we're kind of imposing a different system on them. And I'm using imposing lightly. Y'all know what I mean. How do
Yeah.
we kind of navigate those waters without them getting super frustrated?
Sure. If I could add something. So I think that's a great question, Jason. One thing that we've done at UMS is this is when I was not a coach and I didn't want to be coaching my students necessarily because I was doing all the student affairs work. But there were 3 or 4 faculty who agreed to take on 2 to 3 students for the year and specifically coach them. And they had gone through a coaching course at UT Dallas or wherever. And so what I would first just talk to the student. And when I realized that they've got some challenges, they have great potential, I would ask them, how do you feel about being coached? I'd give them an introductory sort of idea of what coaching means and what that would be. And I would assign them to the faculty member. And then they would have that longitudinal relationship and have 8 sessions with the faculty member and then circle back with me if they needed it. So that's kind of how I did it. We had 2 or 3 faculty who said, yeah, I need the hours. I need to be coaching people. This is going to help me with my certification. And they did it for free. And we kept them. And so we had several students assigned to those faculty. So you're right. I chose not to do the stealth method, right? I said, I think you would benefit from more than just me advising you. I think coaching would be a real opportunity for you. And so that's how we did it.
Thank you. I think that's a great example. All right. So it looks like we are moving on to the next case.
Thanks, Brooke. And what a great preclinical case. Jason, just to quickly, so in our program, we're mentors and we're the coaches as mentors. And we're really trying to start day one in medical school normalizing, like, we all need to be coached. It's a longitudinal relationship. I need to be coached as faculty, residents. It's sort of normalizing that and really day one, bringing it into this is part of your medical school journey. So sort of building on the preclinical, of course, we all have students that eventually start their clinical rotations and sometimes encounter issues along the way. So such was the case with my student who had a challenging 3rd year. She had some issues with grading, feeling she was graded unfairly. She had concerns about OSCE grading. Several of my other mentees interacted with her and felt she wasn't a team player. She was bored at times. She wasn't really great at hiding her boredom. In fact, one of the faculty involved in the pediatric OSCE reached out to me and said, he tried to give her some feedback and she was particularly defensive. And that kind of said, "Ooh, that's an issue. I want to alert you about that." So I met with her and, I'm her mentor, advisor, and coach. And I had sort of told her that I will be doing all of these things depending on the need. So we worked with her and I talked with her about her defensiveness. I talked about the importance of her being able to reflect on a situation and give an accurate self-assessment of her performance. We looked at feedback together. At UMass, we have these portfolios, which are collections of feedback. So we're able to examine them, as a team. And I asked her to reflect on her feedback. And, I was a little struck by, again, her little bit lack of self-awareness when she said she wasn't concerned about the feedback she was passing. And she wanted to be an anesthesiologist. So really, is the feedback from OBGYN or pediatrics particularly germane or important? Despite that attitude, we worked and she kind of took a step back and I thought it improved. And I, saw improvement in performance. I hadn't heard any more of that growth kind of feedback I had heard earlier. So I thought, okay, I'm on my way to an uneventful 4th year. This is marvelous. Until I received a call from the renal elective director who described a particularly worrisome incident where they were running patients for the renal list. And she was observed by the team to be texting and looking up things on her phone. And so when the team sort of called her on that and said, what are you doing on your phone? She said, oh, I'm looking up clinical trials and information up to date. That wasn't particularly well received by the team and they were very skeptical. So the student has had a history of anxiety and she's utilized student counseling, but both she and the counselor feel like her anxiety is well controlled and no concerns. And I'm also not concerned about any concurrent substance use disorder. But this behavior I am concerned about. So as her mentoring coach, I'm concerned about her lack of accountability, her resistance to feedback, and sort of her general lack of emotional intelligence or EQ. I'm wondering, what should I do next? Next slide. So there are quite a few professional development concerns, but here are some of the main ones that struck me. I don't find her to be, despite being in her 4th year of medical school, still really self-aware. Her ability to self-reflect on, deficiencies she has or things that happen along the way, I find still is quite lacking. She still is really quite defensive about feedback that she perceives as negative, or I like to call growth feedback. And I still have some concerns about her overall emotional intelligence. Next slide. So there are many things to coach her on. I'm going to talk about some generalities, and then I'm going to go back to that incident with the cell phone and the texting that I alluded to. So in general, how do you approach a student who is already in her clinical years, he or she, you think, oh my goodness, there's some issues of concern? To be coached, and Sarah and Brooke both alluded to it, you really have to have a relationship to be successful in it, in an environment that feels to the student supportive, safe, and non-judgmental. If students are being judged, they shut down, they're not able to participate in the coaching that they are as students directing. You want to really emphasize the importance of it is student-centered. They need to initiate, they need to be able to be reflection. Some students can reflect verbally. They can sort of very well emote their emotions. I find some students are much better at journaling or writing down their emotions and having time to process it over time. But irregardless, whatever the strategy, self-reflection is a lifelong task that is really helpful in your growth as a physician, in your medical school training, in your residency training, and many years down the road as you are a physician. But really coaching with empathy, students like this can be a lot. They can be frustrating. You could say, oh my goodness, we're talking about the same thing over and over again. So taking a step back as a coach and being empathetic and saying, where is this student? I wonder, I'm curious, where is this student coming from? I'm curious why they're not making the connection. In that way, and I think Sarah alluded to it, asking open-ended questions that really show your curiosity, the what questions, not the why, not the how, which appear somewhat judgmental and the student will be on the defense, but really what? You're curious, you want to understand, you're asking questions to understand. So in this, next slide, please. In this student, in the beginning, when we had these sort of general defensiveness appearing bored, I wanted to take a step back and just sort of understand the what of, does she understand sort of the situation? What does she understand about the impact of her actions? How does she think, her teammates seeing that she's bored and not participating, how could that really affect her own learning and well-being? Certainly, if she's not perceived as a good teammate, how does that affect her ability to be part of a team? And ultimately, how could that affect patient care? Encouraging self-evaluation, understanding her perspective. What is she doing well? Students are always doing things often that are excellent. They're hitting it out of the ballpark in so many things. But what are the areas of growth? We all have them. What does she perceive as areas she needs to improve on? Can she also tell me about those? Feedback. Human nature, we love positive feedback. We don't always love what we perceive as critical or negative feedback, and reframing that feedback as growth feedback. Having the student really understand that as a coach, that feedback is essential to growth and development and progress. And emphasizing to the student that, yes, there's some growth feedback. Let's talk about some tools to improve, and really communicating, I believe you're able to improve. So really imparting that. Now, certainly, this student is actually a good student. This student is a wonderful student. I really like this student. I like working with this student. But sometimes students, they perform in a way that is dangerous to themselves, dangerous to their patients, and dangerous to their career. They're actually failing clinical, work rotations. In this case, certainly we need to also involve student affairs or counseling if we feel like, oh, this lack of self-awareness is actually severe and it is impacting them. Next slide. I wanted to talk for a minute. This student had it, but I also have often seen students and frankly, faculty and human beings having an issue with intent versus impact. Intent is lovely. It's the reason why we're doing things. That's the reason behind our actions. But the impact can sometimes be very discordant. So how are our actions, our intent being misperceived? So, I had a student who wanted to teach another student in their group, a friend, they thought, how to suture. Wonderful. Okay, John, I want to teach you how to suture. I'm really good at this. Let's meet. Sort of really kind of giving them enthusiastic intervention. John, the student, was very offended by this offer. He doesn't need help. He found the offer very condescending. He didn't like the tone of the student. So the intent was lovely. He wanted to, my student wanted to help a colleague. The impact, the perception was completely discordant. And so helping our students understand that sometimes your well-intentioned communication can have an unexpected impact. Next slide. So maybe some strategies, if you find like, wait a minute, that's not what I meant, or I meant this, but this is being received as that, pause, take a pause. And I'll say to the student, take a moment and say, what is the perspective? How might this be perceived? Could, John think that maybe he's a little embarrassed that he doesn't know the skills. Maybe he doesn't want the help. He's not ready to receive the help. Step into another's shoes. What is their perspective? Acknowledge that's the result is not what I hoped for. That's not what I intended. And that's okay. If I've made a misstep and not on purpose, understand and own the consequences. I've inadvertently offended somebody. And if I have, that's not my intent, then a straightforward apology. Listen, John, I apologize. I meant to just be a resource. I did not mean to offend you. I'm here for you when you need, or if you want help, I'm here. But if not, I'm here to support you as a friend. So really be very mindful and very straightforward in your communication. Next slide. Going back though to that last incident. So I was not having any luck with sort of general coaching strategies. So I wanted to invoke, I think, a very specific model that I think would be helpful with my student, especially around that issue of using a cell phone in rounds, which is not an uncommon incident. I'm sure that you've had reports from other faculty about students maybe misusing the cell phone. So I use something called the Gibbs reflective cycle. It's a guided, structured reflection. And the goal is really to help the student analyze an incident, a clinical incident, in this case, sort of an incident with her team, and really kind of look at it and get some perspective. So as part of it, I asked the student for a description. So what are the facts? The facts are the facts. So what are her facts? Her facts are, I used a cell phone during an encounter. Okay, that's pretty, and that was the facts. The faculty had the same exact agreement about the facts. What are the feelings? Here's where we parted ways a little bit. The student, I asked, what did you think about that incident? How did it make you feel? What feelings did you have? What feelings do you think the team had? Well, she felt initially like there was nothing wrong. She was helping the team. She noticed the team's feelings where they felt irritable, angry, suspicious. They didn't like that. She felt anger toward her. So she felt after the reaction that she was judged, she was misunderstood. Okay. So two different divergent sets of feelings. Looking at a little bit, taking another, step back, the day wasn't based on this one encounter. How did the day go before this? What went well? What didn't? So prior to this, she had been having a great day. She had talked to a patient on the floor, and she thought really had a great patient encounter and came up with a wonderful differential diagnosis and was very proud of her presentation. And then obviously this incident was not a great incident. She felt this was a very low point of her day. So looking at this incident, though, what did she learn? And is there something that can be learned from this? She said, yes, I learned that I probably shouldn't use my cell phone on rounds. Okay, and then sort of delving, is there more to learn? Yes, maybe I shouldn't, if I use my cell phone for an aid to our rounds, I should be very clear in my communication. So I should learn to communicate a little better. Team, I'm going to look this up. I'm going to look up a study. I'm using my cell phone. That's why I'm looking up a study, being very clear about what I'm doing with my cell phone. What else could she have done? Her conclusion. Again, being very open to communication, using the cell phone, being clear of what she's using the cell phone for, and letting the team be aware of that. Not being defensive when they give her feedback either, and just saying, oh, I apologize. I should have been more clear. I was looking up something to help our team with this diagnosis. What could she do next time or differently? In general, and I completely agree with this, when she is not needing the cell phone, put it away. She doesn't need to be holding the cell phone. Put it in her pocket, put it in her purse, put it in her lab coat. If she does think, oh, I'd like to look something up, then saying, oh, I'm going to look this up, making sure she's very clear in her communication and action. So we use this, and I thought it was very successful with this specific incident because it really gave her clarity going through this in a stepwise manner. And I'm happy so far. We'll see how it goes, but so far it seems like she's actually learned this lesson and is taking a step back. And I find with this tool that she's able to see the bigger picture with a little bit more clarity than sort of these sort of generalizations I was making before as a coach. And again, student driven, she was coming up with her own plan. Now, this case, obviously, a little bit more specific, and certainly in the clinical realm. I'm curious if any of us on the webinar have had similar circumstances with clinical students who either were not reading the room or really had these deficits in self-awareness or really not understanding their performance and expectations about their performance. Anything to share with our attendees? I'm going to check the chat too while
We have one chat. Because I wonder if asking during the description about the students' perceptions of the hierarchy would be helpful.
I think certainly medicine, as we know, there is in general, as a student, we're part of a team, and there's a structure to the team. So sort of understanding her role in the team might be helpful. I think sometimes in different phases we have different roles. So I think that's certainly a good thought. And I think really what I really wanted to take home with the student is that this is coaching, for medical students is ongoing. It's lifelong, and learning is lifelong, and sort of understanding that this is a step in the process. These tools she's learning will serve her well for the majority of, all of her career. And we all share in that, as professionals, we all want to be able to learn and grow, as we, progress in our career. So really emphasizing this is a lifelong, journey that we're all on, and really normalizing that we all sort of receive feedback and we all need to grow from that feedback.
Absolutely. Dr. Jackson, I see your hand up.
Yeah, I was going to say, I think this is a pretty common issue. It's a space of a lot of frustration for faculty as they really care a lot about their students and they see them do things that they're just like, oh my gosh, you lack a lot of insight around how you're being perceived, how your behavior is being received. I think these are really hard conversations, and I would say it feels like one of the most important things is that solid relationship where the student beforehand feels like you like them, that you have their best interest at heart, that you are really engaging with this with a lot of emotional openness as a coach. And some days are better than others for us as coaches, so anyway, I guess it's an interesting thing to think about. How do we get into the right mindset when we're working with students who have behaviors that might bring up things in us that cause frustration or disappointment or dislike? And then how do we really sort of stay grounded in our relationship with our students and not have as much emotional tie to what their behaviors are? We're just trying to help them think them through and come up with the next step. So kind of early investment maybe in relationships with students, as well as faculty development to help us get ourselves grounded before we engage in some of these conversations.
Yeah, I
And
think,
staff, our staff are doing a lot of this too, staff development too.
yeah, no, I think that's so important. And I think also you're screening for burnouts, Karen. I think that's so wise. But I think, like, as always, you're right on point. It's not about the coaches, it's about the students. So staying grounded, it's not anything personal against me. I'm here to help my students. I'm not taking things personally. I think even, oh, we want to help this person and we're so invested. The student needs to see the value in it. So it's not about the coach. The coach enables this, we're enabling the student. We're opening the student's eyes. So really making sure we're student centered is the key. And it can be frustrating sometimes. We're all human beings checking our own emotions. Our own emotions don't belong. And we're all human. So it's not always possible, but our very best. This is not a judgment. We're here to work with the students. So just that theme, replaying that theme over and over again. It's about working with the students and helping the students.
I think having this piece in place for students as kind of an in-between can be very, very helpful before, I mean, there's so much at stake, and they get sent before a professionalism committee and they're, fearing discipline. And if they have this opportunity to meet with someone that's in a non-judgmental space, that's not the one like sending out the disciplinary action and all of those things, where they can really talk through it, they can like air what they're feeling and what they're thinking, and can be coached through, some of this behavior is really defensiveness and not very helpful. Let's try to reframe it. If they can have the opportunity to have that conversation and have some time to process, I think it can make such a huge difference for them as they have to go through some of the more difficult disciplinary steps in professionalism. Any final comments? We just have a few minutes left. Wow, this hour flew by.
I would just add that I don't know if y'all have ever done these workshops at the beginning of your freshman year. The AAMC ages ago had this workshop, and it's called the value cards. I don't know if y'all have heard of that. So what we still do that. We sort of resurrected that. And so it's a great opportunity for students to center in day one of medical school on their values. And when we would do this, we would sort of remember things, and I would tell the students, put your values, like put them on your bulletin board or something, and keep that keep that close to you, because I mean, the truth is medical school, especially the first 2 years, and even in the third year as well, of course, you sort of lose touch with those basic values sometimes because you get caught up in all the weight of medical school. And so sometimes one of the questions that we love to ask is, well, again, share with me, remember the value card exercise that we did last year or this year earlier? Can you share with me what that is? What that was, what were your values, and how are they manifesting now? And so that's another place I try to come from a place of positivity. And like you said, Molly, very well, like this emotional connection and emotional openness, I think is really important. So then they relax, it creates psychological safety. And then it hopefully leads to other conversations that might be more difficult, but at least hopefully the student feels safer.
Thank you. We put together a few additional coaching resources if you want to explore this further. Our faculty, we did a faculty development book study on the Coactive Coaching book this past year, and it was great. If you're in a place where money's tight, like everywhere right now, this is a great place to start. I mean, I thought this was a great foundation. You don't have to have taken the big coaching course in order to get a lot of kind of foundational information and knowledge. So I really loved that book. All right. We have one more. I'll take the last minute to plug our conference coming up very soon. Registration's open. We hope to see everybody there. Thank you so much to our panelists for your time. We're really grateful.
Appreciate you plugging the annual meeting, Kim. Way to go.